Hey, Russell here from Adelaide West Physio and Pilates. Today's question is, when is back surgery appropriate? Should I have back surgery? It's a difficult question to answer for each individual situation, but I'll give you some broader thoughts on the topic, and I may come across as being anti-surgery, which I'm not, but I think there are circumstances where surgery is at risk of being done unnecessarily or too early in a process. So let me explain. I think there are situations where surgery for back problems is absolutely warranted and immediately warranted, and the situations I don't think anyone could argue with, like if someone has cauda equina compromise. That is, if there's a situation where usually a fairly large disc protrusion, bulge, whatever you want to call it, that's interfering with the function of the cauda equina, which are the spinal nerves that supply the bladder and bowel and sensation around the perineal region. And that's a medical emergency. If someone has cauda equina syndrome, it needs to be decompressed immediately. The other situation is when someone has a trauma that's created a spinal column that's truly unstable, not unstable in the way that physios talk about, oh, your spine is unstable, but more about when the spinal column is structurally unstable because of fracture. And there are many situations where it is absolutely the right thing to do that and to do it immediately. So no argument there. My argument is when there are situations where someone has leg pain that isn't given an opportunity to improve with non-surgical measures first. So, for example, it's quite common for someone to have leg pain that is of a spinal cause and means that they have weakness in a muscle group or a couple of muscle groups that the nerve supplies, or sensation changes, like they're numb in certain areas, or reflex changes. Now, off the bat, they're not necessarily a reason to jump in and do surgery, because that can improve. Those situations can improve, and we see them improve. They don't always, but it's important to give non-surgical measures, physiotherapy, and I'll come back to that, but it's important to give those measures a reasonable run first before going down a surgical route. And a very quick note too is that there is no justification for back surgery to deal with back pain. It just doesn't work, and no surgeons do it anyway, but it's good for you to know that back pain isn't a good reason for back surgery. It's if there's leg pain, if there's referred symptoms, if there are neurological symptoms. What do I mean by neurological symptoms? Like the weakness, sensation changes, reflex changes. Now, the non-surgical intervention that I'm talking about, the physiotherapy, I'm not talking about massage, I'm not talking about dry needling even. What we're talking about here is a considered, well-supported approach to managing someone's problem. And the McKenzie method falls into that category. So with the McKenzie method, for example, you're looking for a direction of movement or a position or a loading strategy that changes those symptoms, that reduces the strength loss or reduces the sensation change or increases the reflexes, the reflex responses. And if you can find a directional preference, then there's a really good chance that you're going to be able to manage the problem non-surgically. Really good chance. And sometimes you can't find a directional preference, and it is a situation where someone, for a period of time, takes a different strategy, which might be graded exercise or hydrotherapy, and then you come back and you re-examine them and find that a directional preference does exist. So that's the other thing that can happen, is you find that at one point in time there's no directional preference, but in a few weeks later you recheck for it and all of a sudden there is. So my gripe is when surgery is done without someone having the opportunity to see whether they are going to actually respond to something that is conservative, something that is non-surgical, and it's easy enough to see if you're getting a response to it, but there needs to be there's a time element too. And I can remember someone years ago that probably 10 years ago now, this particular person that had quite significant radicular, as in symptoms of weakness, of reflex changes, of strength changes, who I would have thought was a really good candidate for surgery, and she just point blank said, no, not going to do it. And she gave it time, and she was very patient, and sure enough, things improved, and she got back her strength, she got back her reflexes and her sensation too, and from then we're able to build her up to being a stronger, more resilient, more confident person in her back. But it took time, and you got to be willing to invest some time into that. But in her case, she was so dead against the idea of surgery that it was a no-brainer. She was going to do that. So the bottom line is, as I said, I'm not anti-surgery at all. I think there are particular use cases for surgery that you can't argue with, but I would argue strongly against situations where people have unnecessary injections, unnecessary surgeries for problems that potentially could respond quite well to non-surgical methods. And that's where we find the McKenzie method so useful, is that it helps to categorize the people who are going to respond or who are likely to respond from those who aren't going to respond. And even then, for the ones that aren't going to respond, it's reasonable for there to be a time element to give people a chance to see whether things are going to improve and become responders again to a direction or not. So that's my 2 cents on it. If you've got any comments, if you disagree, if you've got any questions, just put them in the comments below, and we'd love to hear from you. Cheers.